What are the side effects of these surgeries?
Actually, there is not a side effect. Side effect is for the medicine. For us, it is the complications. Every surgery has some complication and all, but it doesn't mean every surgery will develop the complication. It is very rare. Let us take the breast surgery and thyroid surgery, as you said before. The breast surgery, the immediate complication is the bleeding, and also after post-op, it is again the bleeding, infection of the wound. And sometimes what happens during this breast surgeries, if it is a total mastectomy, not a small, like not fibroadenoma, let's take a cancer. Sometimes we cut the many nerves inside, so that may cause the loss of sensation in her arm, pain and all that. So in the thyroid, there are two main dangerous complications, immediate and later. Immediately, again, if it is a bleeding here, it can compress his windpipe, we can say, airway. So patient may go into the coma, hypoxic brain damage and death. And later there is one nerve through which helps us in speaking, actually, to generate our voice. That's called a recurrent laryngeal nerve. It's on one side and other side. If you cut one, it's the hoarseness of voice, you know, the low pitch voice. And if you cut both, patient will go. So both the complications of the thyroid are dangerous. In the breast, although we can manage the hemorrhage after, can take patient back to the OT and this, but thyroid, you need to be very conscious. This is the dangerous complication.
Can you tell us something about hernia surgery?
Hernia is actually the patient presents with swelling like a lump. It is actually your contents inside coming out as a outpouching like that. So when patient comes with, there are two types of surgery in the hernia, means where patient can go for the surgery. Once patient willfully comes that I have a swelling, I don't have pain, I don't have vomiting effects, but I want to get rid of it because it is in his mind I have something here. Other patient ignores it because he doesn't have any symptoms. Most of the patients who brings to the patient to doctor, this is the pain. So most of the patients, like 80%, ignore it as a swelling, but it doesn't give me anything, let it be. So when he starts the pain, that means already it started complicated inside, sometimes overstress, sometimes adhesion, sometimes whatever. And that time patient comes for the surgery. In both ways, it needs surgery.
How long does the surgery take?
Depends upon the expertization of the surgery. Usually it takes 45 minutes to 1 hour maximum, but if it's uncomplicated. So at the end, it depends upon the surgeon, how fast he is, how expert he is, and how experienced he is. So it depends on all.